Well, good afternoon or good morning, everybody. We will get started in a minute. My name's David. We'll just let everybody come in. We'll talk soon. Thanks. Well, good afternoon for those on the eastern side of the country. Still good morning to those on the west coast and in Alberta, just turning over into noon. My name is David Coletto, and I am the CEO of AbacusData, a polling firm based in Ottawa and Toronto. And I want to welcome you to our session today that's being hosted by HealthCareCAN, in which I'm going to present some data on a recent public opinion survey, with the timing being pretty perfect given the First Minister's meeting coming up later this week, with the focus going to be on healthcare and the pandemic. Before I get into the results, though, I'm very excited to introduce Mr. Rob McIsaac. He is the President and CEO of the Hamilton Health Services that represents or manages 6 facilities in and around Hamilton. And so Rob is also the chair of HealthCareCAN and has a few short words to introduce this. Rob, over to you.
Thanks very much, David, and good afternoon, everybody, and welcome. As David said, I'm Rob McIsaac, and I'm the chair of HealthCareCAN's board of directors, as well as I'm with Hamilton Health Sciences. So very happy to welcome you and delighted that you have joined us for what I think will be a really interesting hour. Understanding the impacts of COVID that they will have on our government's actions and policies, I think requires an appreciation of the collective mood of our fellow citizens. Governments may have ideological anchors, but political winds still account for a fair bit of movement by them in response to shifting public sentiment. HealthCareCAN is the national voice of healthcare and health research institutions from across the country. We are committed to working to find ways to not waste this crisis, to paraphrase Churchill. We want to take the difficult lessons that COVID is highlighting and use them to make our system better. To that end, we partnered with AbacusData to find out what Canadians think. As many of you know, Abacus is one of Canada's leading public opinion research companies with an impressive track record of successfully predicting elections and providing insight into government policy. That said, it's my pleasure to turn it back to David Coletto, founder and CEO of Abacus, who will walk us through what his research has found, and then we will open the floor for questions and discussion, perhaps a word or two from our CEO, Paul-Emile Cloutier as well. David, back to you.
Thanks, Rob, and thanks for working with us. And Paul-Emile is a panelist. We'll get him to come in a little bit later, but you can wave and he's there with us watching. So I'm going to jump right into it. It's I've got a lot of data, and I want to give it as much attention as I can. And I want to start with kind of the 3 takeaways as I see it that we tried to explore. As you might expect, the first key thing is we're still in the midst of a pandemic. It's a pandemic that in almost every part of the world, including almost every region of this country, has gotten particularly worse over the past number of months. As a result, as you'd expect, concern about that pandemic has also risen. I'll share some data from our tracking, not just from this survey that we did for HealthCareCAN, but our ongoing tracking on that question. The other side of it, though, is despite, as I'll show you, increasing concern about whether our health system has the capacity to deal with both the pandemic and all the other things that it needs to serve, ongoing scheduled treatments and procedures, emergency procedures, but also then what the pandemic has created. Most believe the health system has responded acceptably. Not, great, not over the moon happy, but acceptably. That being said, most also think, though, there are real problems. And as Rob mentioned, it's exposed to people some of the weaknesses or challenges that our system face and has brought new attention to them. I'll talk a little bit about that. And then lastly is this whole question of what is the role of the federal government? HealthCareCAN is the national voice for institutions like the one Rob leads. And it has been advocating for a greater role for the federal government in leading and setting standards around the health system and how to invest in it and grow it and make it stronger and more resilient for Canadians. We explored that question in our survey. And as you might expect, few worry about jurisdictional fights. Most want action and leadership on this question. Now, most of the data in this survey comes from a national survey we just completed this week. We interviewed almost 2,000 Canadian adults from coast to coast, matching the population by age, gender, region, education, official language, and the margin of error is about 2.2%, 19 times out of 20. So we've got a large national sample that we can also look at some regional differences and across some subgroups. But I'm going to focus primarily today on the top line story. And I start with the pandemic and setting the context for how Canadians are feeling today and how that's evolved over time. For me, one of the key questions I've been asking throughout, and we've been tracking public opinion towards the pandemic since the very beginning, is a question that gauges what I call momentum, either towards feeling worse or more worried about the pandemic, towards feeling less worried. And you can see that as of this week, still half of Canadians say that in the past 7 days, they have become more worried about COVID-19 and the pandemic than in the previous week. And only 10% say their anxiety levels are starting to come down. That's been basically the status quo now since the start of the fall, where we saw between August and September a sharp rise in that red line that was only matched from the early days, right? Throughout the spring and summer, we saw a leveling down. And if you actually superimpose the number of cases in Canada with this line, you actually see there's a strong correlation. So that as case numbers go up, so too do people's concerns. And it's worth noting when we look at it from a regional perspective in this most recent survey, while there is some regional variation, those in Atlantic Canada, a little less likely to say they're more worried today than they were a week ago, a little higher in Quebec. It's fairly consistent across the country. That's a relatively new aspect of public opinion, where in the early days of this, because of the more concentrated number of cases in Ontario, Quebec, and BC to some extent, we did see some much larger variation across the country. Today, it's pretty universal. About half of Canadians living in any part of the country feel that they're getting more worried as opposed to less worried over time. Now, what's driving that? Well, certainly this remains a health crisis. It remains a crisis in which most people now are worried about a family member getting COVID, or half, 13 points higher than in June, saying they're concerned about getting it themselves. So as the number of cases has increased, so too has the risk perception that people are feeling. And so at the core still, the question is, am I going to get this virus? Is somebody I love in my family going to get this virus? And what does that mean for the way that I'm going to live my life and the choices that I'm making? Now, all of that points, though, to a scenario where, despite, and I'll show you some good news or some interesting news related to the vaccine that is now, I just noticed this morning watching the news, the first vaccination happened in the UK today, so there's some hope and some optimism. But even as of early this week, despite lots of news about vaccines and vaccines coming to Canada, just still over half of Canadians think the worst is still to come when it comes to this corona virus outbreak. And that's been over the 50-point mark since September, right? So even though there's some optimism and some hope about vaccines down the road, most people still say the worst is still to come. That is putting them in a very defensive position. A big part of that relates to concerns around the broader impact that COVID is having on the health system writ large. When we ask Canadians, how worried are you or concerned are you about there not being enough hospital beds? You can see we've seen a rapid increase, significant change, 22-point increase in those saying they are concerned about there not being enough hospital beds. Almost 60% today or in November said that. 56% are worried about not having enough medical equipment to deal with the pandemic, up 18 percentage points since June. And so as the case numbers rise, as people's anxieties go up, as stories start to come out about hospital beds being repurposed away from, say, post-surgery recovery to ICU beds, people not only are worried about whether if they were to get COVID, could the system support them, but also if they were to have some other illness or emergency in which they need medical attention, will the system be there for you? And I'll come back to the percentage of people who say they've reported delays in treatments or procedures as a result of it. Now, all of this is happening at the same time that, as I said, talk about vaccines are starting to lift spirits a little bit. In another survey we did, we asked Canadians a number of scenarios and said, if you were able to get a vaccine in these different time periods, January, February, March or April, you can see the list goes on, would that be great or acceptable to you, or is that unacceptable? And so this green sort of box represents those saying it would be either great or acceptable if a vaccine was ready for them in these time periods. And you can see that for January, February, March, most people say that's great or acceptable. I think that would work for me. But we start to see a very sharp drop off once we hit the spring in May, June, drops to below 50% in July and September. And only a quarter of Canadians say it would be acceptable or, and it's not really great, if they had to wait until 2022 to get that vaccine. Now, there is a level of vaccine hesitation that already exists. About 12 to 13% in surveys we do say they're not going to get the vaccine. So you build that in, and you basically have a period in which most people are hoping and are willing to kind of feel satisfied if that vaccine is ready by the end of the winter. And that makes sense, for Canadians, because we can get through the winter, but the moment the weather starts to get better, I really want out, and I want this vaccine to be widespread. So this is not necessarily when people expect it to happen, but it is when they'd like it to happen and how they would react to different things. Now, one of the other things my team at Abacus, we've recently started to track is something we call national happiness or just a general happiness measure. And we ask people on a scale from 0 to 100, how happy are you feeling right now? And we started tracking this in October, at the end of October. And we've been doing it on every survey that we've fielded since then. And we just noticed, even in the last few weeks, a really interesting phenomenon happen, right? So we've got data between October 25th and December 7th. And the starting point, the first two waves that we did, we saw on average 62 out of 100 being where the average happiness is across the country. And if you're interested in this, we released some new data today on the relationship between mental health and happiness. And we're going to continue to release stuff on this because I find it so interesting looking at it through different lenses. But what we did notice is as you kind of go ahead, we noticed this spike in happiness, a 10 percentage point or 10-point increase in happiness. Now this is, a 2 or 3 point change is real statistically. A 10-point change is a substantial jump. Then it kind of came back down a little bit and then sunk right back down, right? And so what I like to do is step back and say, what could have caused this blip in happiness across the country? And it's really interesting when you look at the timing of some vaccine announcements, right? Pfizer with their first announcement, then Moderna, then Pfizer updated their announcement. Then you had AstraZeneca come out on November 23rd. And then you had the Prime Minister and a whole debate happen about whether we might have to wait for vaccines or whether we're going to be second in line. And we saw this little bit of a significant drop back. So in a very short period of time, you can see how right now the collective, sense of the mood of the country is tied to this pandemic. It's not surprising, but it's showing up in other data points that we've been tracking. And so our happiness as a country will be strongly tied to how fast and quickly we feel we can get back to normal. And we're going to continue to monitor that. So all of this then says as a context that there is continued growing anxiety around COVID-19 as that second spike continues. With winter coming, that's creating, I think, more anxiety, more uncertainty about how life's going to be like, about mental health during this period. Obviously, Christmas and the holiday season is going to be a moment where this thing goes even worse, or we listen to health authorities and we stay home and we don't gather. As I said, health happiness is kind of linked to concerns about the pandemic and the hope for a vaccine. But that number, that 56% who still think the worst is still to come, reflects a very challenging mindset among the country right now. And it really is, I think, defines the concept, the context. So with that being said, what we did as part of the work with HealthCareCAN is we wanted to sort of gauge perceptions of the healthcare system today and use this as a way to understand where Canadians feel the system has performed well, areas where they think there's room for improvement, and what do they see as being the long-term priorities, particularly as the federal government thinks about not only its short-term support for Canadians and institutions helping to deal with this pandemic, but also the longer term recovery and what role healthcare and health innovation and health investments will make in that recovery going forward. So as a starting point, when we ask Canadians to rate the performance of the system, the health system in their province on a number of metrics, the green bars represent those who say excellent or acceptable. The red are those who say unacceptable or terrible. I think the point here is that there are very few, particularly the first three, or in any of them, in which a large number of Canadians think that our system in any of these areas, research, infrastructure and buildings, wait times, emergency room wait times, and the ability to interact with a health professional virtually, very few say we're doing an excellent job in any part of this country. Now, the difference between acceptable and unacceptable shows really between the three at the top, in which a majority think that medical research and innovation is at least acceptable. The quality of hospital buildings and infrastructure, most say at least acceptable. Even the ability to interact with a health professional, which research we did with the Canadian Medical Association earlier this year showed large numbers of Canadians had used virtual care services or options the first time and generally were satisfied with that experience. And so obviously when we do this survey now, that number is probably much higher than it would have been prior to this pandemic. But the areas where there's still deep frustration and disappointment, I think, is concern around wait times in terms of emergency rooms, scheduled procedures and emergency procedures. And that has probably been even more acute given all the stories about how people have had delayed different treatments and surgeries as a result of the pandemic and the capacity challenges that hospitals and health health professional challenges that they're facing. The other side of this is, and we live in a federation where healthcare is delivered slightly differently in every province, and different provinces have different resources or systems in place. Canadians generally recognize that there are differences depending on where you live, some greater than others. And what we've asked here is we said, do you think that there are big differences, minor differences, or no real differences in these different aspects of the health system across the country? And you can see when it comes to the time to get scheduled surgeries, access to family doctors, capacity of hospitals, most Canadians believe there's at least minor differences across the country, but almost half say there are big differences, particularly if you live in Quebec and Atlantic Canada. Atlantic Canadians are the most likely to think that there are different levels of service in different parts of the country, in part because they believe they get less service than other regions. But it's a reflection that, and perhaps a call to explain data that's about to come, why there's broad-based support for national leadership to create a more uniform experience, so that a Canadian receiving care in one province gets the same kind of care, the same quality of care, the same speed of access that someone in another part of the country will as well. But the point here is that people do perceive there to be significant differences on a range of aspects of the health system. Now, one of the maybe, I don't know, good news stories out of this, we did some similar research for Healthcare Canada prior to the last federal election. And one of the questions we asked respondents to describe the health system between two options. We kind of want to force them into, for example, would you describe the system as digital or analog? Looking to the future, stuck in the past, easy to access, hard to access, innovative, slow to change. And what's interesting in that all four of these cases, this plus number represents the change from 2019. So Canadians today are more likely to believe that the system's digital, that it's looking to the future, that it's easier to access, despite some access challenges. There's a sense that at least everyone can access it. The system's there for people who need it, and even a 9-point increase in those who saying it's innovative. Now, more still believe the system's slow to change, but I think what this pandemic has done for healthcare, like it's done in every other sector, is that it's accelerated many of the changes that I know leaders like Paul Emile and Rob McIsaac were talking about in our conversations before the pandemic. You wanted to get to virtual care faster. You wanted more innovation in healthcare. Well, the pandemic forced that. And the country, I think Canadians are responding and seeing that change firsthand. And I think is where, frankly, they want it to be going. The second question the survey wanted to explore was, how has the pandemic how has the system, responded to the pandemic? And what we found, as I said earlier, 72% of Canadians believe the health system in Canada has responded to COVID-19, or its response has been excellent or acceptable. So for most, they look at the response, and there's not a lot of variation by province, which is interesting. Most subpopulations think their province's health system has handled it pretty well. Is we feel pretty good about how the system's handled the pressure so far and the challenges that the pandemic has created. Now, 1 out of 4 Canadians don't believe that. They think the system hasn't responded well enough. And those are people who have most likely been affected by disruptions caused by the pandemic, who have lost treatment. And that, and so when we unpack that though, and we go a little deeper, and we ask respondents to pick between two statements, which one best describes your view of the situation today? That either the pandemic has shown that our health system needs a lot of work, it is not properly resourced, it is not the same in all parts of the country, and needs major improvements now. 71% say that viewpoint is closer to their own, as opposed to the view that actually the pandemic has shown that our health system is in a strong position, it has responded well, has enough resources, and could handle the stress the pandemic created. It doesn't need major improvements, right? And we threw up this hypothetical. These are both hypothetical views, but it demonstrates that despite people feeling relatively good about how the system responded, it actually, they were already feeling quite vulnerable and concerned about the system even before this pandemic came along. And one of the things that I'm always asked, because we do a lot of election polling, even all through most of the last federal election in Canada, healthcare was consistently in the top 2 issues. And people would say to me, well, David, that's always the case. Canadians are always going to say healthcare is the top issue, so we can discount it. And I say, why are you discounting it? That's what people are saying. It is a top issue. And so I think what this pandemic has done, and this question confirms, is not that the pandemic created a problem. The pandemic simply created a new problem, but exposed a pre-existing problem, which was our system for people doesn't really work well, was under-resourced, and wasn't the same everywhere. And that was exposed in particular to a subset of Canadians who truly felt the disruption of the pandemic on their other health conditions. So 13% of Canadians said, yes, I have experienced a delay in getting treatment for a health condition because of COVID-19. 15% also report that someone in their family had experienced that. So we have large numbers. Those are millions of Canadians who've experienced some disruption or delay in getting treatment or surgeries or seeing a specialist or you name it, that they weren't able to see because of this pandemic creating a further capacity challenge on the health system. Now, I will say the other thing that this survey confirms, and we asked a specific question that really highlighted it, is that, in all the research we've done, Canadians, I think, have a deeper appreciation, because it was always deep, but a deeper appreciation for all health professionals and all folks who are helping to deliver the health system and their health services. But this question confirms it, where we ask, we came up with an idea that I know Paul Emil's thinking about. How can the federal government help support frontline workers and the cost of increasing the human resource side of the health system? What if we created a $3,000 federal tax credit for healthcare workers who make less than $100,000 a year? Would you support or oppose that? And you can see overwhelming support in all regions of the country across the political spectrum for that idea as a way for the federal government to use its financial resources to help, in ways that a hospital may not be able, or a health authority may not be able to give their health care workers a raise. They don't have the funds to do it. Without the federal government might be able to do that through this kind of fiscal measure. So speaking about the federal government's role then in the last part of this survey, we wanted to test a number of ideas. And this really, I think, is not surprising to me, because I've been doing research on this for many years, and I consistently see large numbers of people who believe that the federal government actually, even if it doesn't have a formal role in the delivery of health care, should be a leader in helping to lead and set standards for the healthcare system across the country. 74% of Canadians agree that the federal government should play a bigger role in healthcare than it does today, including 70% in Quebec. And you'll see throughout, and I don't mean to pick on Quebec, but Quebec has often been, and Quebecers, the most defensive of provincial jurisdiction, right? And so the hypothesis would be that while maybe Ontarians or British Columbians even might be more open to the federal government playing a greater role in healthcare delivery or healthcare policy, that Quebecers would be the most resistant. While we find in some areas they are more resistant, most aren't. And here's another example where it's only a 4-point difference between the national average and the view in Quebec. So even 70% of Quebecers think the federal government should play a bigger role. We see it also across the political spectrum. So 83% of Liberals think that, 69% of Conservative voters, even 2/3 of those who voted for the Bloc in the last election believe that the federal government should play a bigger role in healthcare than it does today. That's true across New Democrats, Green. There's a multi-party consensus because healthcare as a top issue is multi-partisan. Some issues like climate change divide Conservatives and Liberals. Tax cuts and debt divides Conservatives and Liberals, but healthcare is one of those issues that actually unites us, that regardless of your age, regardless of where you live, regardless of your political persuasion, you care about this issue deeply. Similarly, 77% across the country agree there should be national guidelines and standards for managing healthcare networks. Well, here we see Quebec, 20 percentage points less likely, but still even a majority in Quebec agree that the federal government, or at least some organization nationally, should set national standards and guidelines. I should note, one reason why I think we see this in Quebec in particular is because Quebecers are actually, when we asked about the performance of their health system, they were the most likely to feel that the system wasn't working as well as it should. And so I think that plays into their desire to see perhaps, or at least most people in the province, to see some federal involvement. The federal government should invest directly in hospitals to achieve national healthcare goals. 80% agree with that statement. Similarly, 80% in Quebec, right? How that would work, Paul Emil's got lots of ideas on that, but seeing a direct involvement between the federal government and individual hospital or hospital networks is something that almost every Canadian can get behind. And then lastly, the federal government should play a leadership role in healthcare. And we put in a proviso, even if healthcare is a provincial responsibility, 74% of Canadians agree, including 65% in Quebec. All of these data points, asked in multiple ways using different language, all point to the same thing, which is Canadians believe the federal government should play a role and should play a leadership role in healthcare in the country. And that's true across the political spectrum. 82% of Liberals, 72% of Conservatives, 51% even, slight majority of BQ supporters all agree with that as well. The last point I want to make, as the federal government starts to decide where its priorities are, we saw a throne speech earlier this year. We saw the economic statement last week from the Minister of Finance. It's still focused on the here and now, but as they start to plan the recovery and the rebuilding of different institutions and getting the economy and our social and our health systems back on track, we asked a number of questions around what Canadians think the priorities should be. And we asked this question first, so I'm showing it to you last, but we didn't kind of lead them here. We started with this question. 90% of Canadians believe improving the quality and capacity of hospitals should be a top or high priority for the federal government. And I'll show you the list of things we compared it to. So you can see right at the top here, improving the quality and capacity of hospitals. 45% say it should be a top priority, far higher than any other item. And another 45% say it should be a high priority. That's 90%. Other issues that are important, given the economic crisis the pandemic has created, not surprising that preparing Canadians for the economy of the future, that includes like reskilling, retraining, education investments are high up there. Improving access to affordable prescription drugs, so pharmacare, that debate continues. 80% think that should be a priority. And then you can go down the list, investing in infrastructure, changing the way the tax system works or the way businesses are regulated to grow the economy. 75%. You can see climate change, a very divisive issue in the country. 61% say it should be a top or high priority, and then expanding access to affordable broadband and internet. The point here is, all I want to make is, when we give all of these different items, the issue in which almost everybody says should at least be a high priority is increasing the quality and capacity of hospitals. And when we ask people to pick the top three of that long list, more people put improving quality and capacity of hospitals in their top three. 60% put it in their top three, 13 points higher than anything else that we've invested in. Economic growth is important to people, but so too is the health system. And so to me, that's a clear signal that, hospitals in particular, capacity building, and the health system are top of mind. So to wrap up, implications of all of this. First, I want to put first and foremost, I continue to see healthcare as a top priority for the country. It is a top issue, and more so now, as we live through 8 months of a global pandemic. People, we see in other research we do, have a better appreciation for their own health. They're more aware of their vulnerability, of how quickly things can go from good to bad, and the need to have a strong, resilient safety net, i.e. a hospital, i.e. a health system there to help them when they need it. The pandemic has been a harsh reality. It's brought more attention to the system. It's actually created more challenges for folks like, for Rob and other health leaders across the country, because people are paying attention more to how the system's responding and how they use the resources they have and whether there's enough resources to get the job done. Broad desire for federal leadership. I just highlight again, even in Quebec. And that lastly, healthcare capacity, I believe, based on this data, Canadians want it to be part of the federal post-COVID recovery plan. It is a top priority. And we'll see what comes out of the First Minister's meeting, but I suspect, the premiers want it to be one, but maybe not in the way that Canadians expect, which is a federal role in setting some standards and guidelines to make sure that everybody gets access to the same care. So on that note, I will stop for a moment and introduce Paul-Emile Cloutier. He is the President and CEO of HealthCareCAN to make a few sort of remarks on what he thought these results mean, and then we'll open it up to questions. I encourage anyone who's got questions, we'll take your questions through the Q&A function. I'll moderate that section, but over to you, Paul-Emile, for now.
David, thank you very much. And let me start with the word that what you've done today was excellent. It's an excellent presentation, and it's well received by all of the participants. Today's session has provided a clear look into Canadian perception, fears, and needs as they pertain to the healthcare in Canada. La séance d'aujourd'hui nous a permis de faire un constat très clair sur le point de vue, les craintes, les besoins des Canadiens en termes de soins de santé au Canada. The responses that we have heard show a recognition of the important steps taken to battle COVID-19 in Canada over the last 10 months, and how our frontline workers help to ensure quality in serving patient needs. However, most importantly, the response show a clear desire for a system that works better, for a system that addresses long-standing capacity and access issue, for a system that supports those that work so hard within it instead of the ones that leaves them exhausted. Also for a system that does not teeter on the verge of collapse when faced with a crisis. You were right, David, when you said on Thursday, the Canada premiers and the Prime Minister will be meeting to discuss vaccine distribution, health, and health transfer. So I believe the timing of our exercise could not have been better. So Canadians now with this exercise are asking clearly and saying they expect the federal government to learn the harsh lessons from COVID and to step up and provide greater resources and ensure pan-Canadian standards and guidelines for healthcare. Federal, provincial, and territorial leaders have an opportunity now to show true leadership. Canadians are looking to them for solutions that addresses capacity issues, staffing shortage, and unpredictable financing. Les dirigeants fédéraux, provinciaux et territoriaux ont une occasion en or de faire preuve d'un véritable leadership. Les Canadiens s'attendent à des solutions de la part des gouvernements sur les problèmes de capacité, les pénuries de personnel et le financement imprévisible. Addressing these barriers will reduce the burden placed on Canada's frontline health workers. Addressing these barriers will reduce the burden placed on Canada's frontline health workers and provide much needed stability, security, and support so that they can continue delivering the high quality care that Canadians deserve. I think here in Canada, we are blessed with some of the best frontline healthcare providers, support staff in the world, and we need to build a system that better helps them provide timely and high quality care. HealthCareCAN, as the voice of Canada's healthcare and health research institutions, will remain committed and does remain committed to working with policymakers to help make that happen. Again, thank you, David, for this excellent presentation. And now I guess we'll open it to the questions and answers. Et je remercie tout le monde qui ont participé.
Well, thanks, Paul-Emile, and I just take it somebody's trying to find you, so we'll let you take care of that. We've got a number of questions already coming in, and I encourage you to share. I've got one from Monica who asks, do you have any insight on how COVID might change public support for expanding healthcare coverage for other services like mental health care? I can speak quickly to that one, Monica. I think it's a great question. I think we've seen in other research we've done even before the pandemic that there was already broad support appeal for other services being covered by public support. I think there's very, very rarely you're going to find public support for delisting services or pulling back. In fact, you're going to often find a lot of support for, we even saw during the federal election, the New Democrats proposed, dental care coverage, certainly pharmacare as an example. There's broad support for those kinds of expansions. And so I think and this pandemic has put an additional spotlight on mental health. I think that will create even more demand for those kinds of services being covered, and for us to have a conversation about how do we bring that into the full envelope in terms of delivering healthcare. But I do certainly think that's going to happen. Paul Emile, do you have any thoughts on expanding coverage of different services like healthcare, mental health care?
Well, I think there is the topic of discussion in Ottawa as to how do we address this particular challenge. So I think Ottawa will have no other choice than to address it in collaboration with the provinces, because it is becoming a big issue. Our members are telling us that yes, they have a problem with COVID-19, the second wave, but they are much better prepared for the second wave than they were for the first wave. But one of the main concerns that arises every time when I speak to a CEO is the exhaustion, the stress level of the healthcare workers, where they need some care and some attention in terms of well-being. So I believe that Ottawa and the provinces will have to address that, because that might become your third wave if we can resolve COVID-19.
Maybe I could just build off that, Paul Emile, like based on what you're hearing from your members, and Rob, you might have some, on the ground feedback on this. Is there a risk that, the longer this pandemic goes on, that what might have already been a challenge recruiting people into different health professions, are we going to, is one of the long-term legacies of this a human resource gap in terms of not just being able to afford to pay for the resources we need, but finding the actual people to do these jobs? Are you seeing evidence of that?
Yeah, so I would say, and I expect this is the experience across the country, health human resources is the rate limiting factor for almost everything we're doing. And we saw shortages in some key areas before the pandemic. What the pandemic has really just shone a bright spotlight on those gaps that were pre-existing. But I think in other areas, the pandemic has caused an explicit shortage, because for certain occupations within healthcare that are not well paid, many of those people have left the battlefield because, to be earning minimum wage, working split shifts on a constant basis, not feeling that you have appropriate access to personal, to equipment to protect yourself from the virus. Many people have just said, well, I'm better off working at Tim Hortons than doing this. And so there's been huge numbers of people who've left the workforce. So it's a very significant concern for, I think, everybody trying to manage healthcare situations right now.
David, in terms of Quebec, and this is a number that I know of, the amount of staff, health worker staff, who have left the system to take an early retirement is extremely high. You see some numbers like 200 to 300 of them have left. So when they leave, then who takes over is a big issue for a manager or for a director of a hospital. So, and then you're going to see more of those as we go on.
Interesting. We've got another question about seniors and among vulnerable populations. So I'll just quickly read it. The data is very acute care focused, and that there is a focus on that, I do admit. And this person writes, yet the effects of the pandemic were felt more dramatically among our vulnerable and seniors populations in residential care, which is also a significant portion of our health system. How can this research help us to shift to a more holistic view and planning model for healthcare, but encompasses vulnerable populations and the need to reduce burdens on our acute system with more community-based support and care. I will, I'm going to defer to one of you two gentlemen on that one, but I think, Paul Emile, I will say, other research we've done, and in our conversations in preparing this research, I think there was an understanding that Canadians, if anything this pandemic has done, it's put a spotlight on that exact issue, right? We always knew there were deep challenges in our long-term care and residential care systems, but this has made it a national priority. Mm-hmm. What's your sense on that question and how your members and the systems as a whole now are going to treat long-term care and seniors and vulnerable populations in particular?
I think it's an excellent question, and it's one that needs to be addressed and analyzed. And that's something to which we may be willing to do with other partners. When you talk about the continuum of care, we often forget long-term care, home care, and we just talk about the acute care. So my sense is that this pandemic certainly has alerted us that there is another part of our health system that it was really not being paid attention enough, and that we need at this moment to pay some attention. So I probably would invite that person who asked that question to meet with us and see how we can collaborate and do maybe some more research and come up with some of the solutions that need to be taken by the provinces as well as the federal government. I think there's an interest already at Health Canada to look at long-term care and see how they could actually insert that into the Canada Health Act or any other legislation that will allow the federal government to play a bigger role than they have been in the past.
And I think that issue also comes into the forefront as our aging population continues to progress, right? Like that overriding all of this, and other research we've done with HEAL and other groups has shown Canadians recognize we're also an aging population, and that the capacity of our health system, we were already doubting it. Now the pandemic has just given us an acute picture of what that looks like. And I think that's something that policymakers at all levels are going to have to grapple with. I'm just going to look at other questions here. Well, Rob, you asked me a question and I thought it was a good one. So I'm going to, maybe you can sort of raise it and then we can have a conversation about it.
Well, so my question was really around people's appetite for different models of care provision, because, we know that coming out of last spring, there was a very large backlog built up in scheduled care, procedures and surgeries. And at least one of the proposals that I'm seeing floated in Ontario is public-private partnerships. That concept has traditionally been the third rail of Canadian politics. Nobody ever wants to talk about it. Do you think this most recent experience would be changing people's views on that?
I think it has the chance. I think you're right. It is the third rail. It's one of the few things that unites everybody across the political spectrum, pretty much. But it doesn't mean a public-private partnership that helps solve a crisis and a problem can't ultimately be accepted as long as people believe that the fundamentals of it, meaning access, affordability, are still put in place, right? So I think the pandemic on every front has thrown out the rule book and allowed people to at least open their minds to new solutions. I still think it might be a hard sell, and you're going to it'll be very easy for opponents of it to raise sort of the backs up of people. But I also know that, there's talk of improving or having a national strategy for self-care and other ways that we can create a more effective system overall. But certainly I think that's an idea, but I'm not 100% sure you'll find broad support right off the bat. You'll have to demonstrate to people how those things they worry about the most are still protected as a result. Paul Emile, you raised the question when I first shared the results with you, because I know you're focused a lot on infrastructure, right? And the physical resources that your members, hospitals have to deliver services, whether it's the building itself or the actual equipment. And early on in the survey, you pointed out that most Canadians felt that, their provincial health system, when it came to infrastructure and buildings, was acceptable, at least, right? Not many people saying it's excellent, but they described it as accessible. And yet, at the same time, this survey also pointed to a general feeling that the capacity of the health system wasn't there. And you said, how could both be true?
Mm-hmm.
It's a good question. And I think it's partly a way that people talk. It's a way that maybe the health community talks about infrastructure and the way the public believes that word to mean. And I think, we're used to hearing infrastructure and thinking roads, buildings, bridges, and not instantly thinking diagnostic equipment or, surgery or medical equipment that we need to actually deliver it. And so I think conflating the two is doesn't align with where the public's head's at on that. And so it might require us to talk more about capacity and the need for both, obviously, human resources to deliver capacity, but also physical resources as a way to disentangle those two. Because I think if we ask people, well, we saw it on all the capacity questions: wait times for scheduled procedures, wait times for emergency, wait times for emergency rooms, large numbers saying terrible to describe their health systems, not just unacceptable. And that is the other side of that infrastructure coin. And so that's how you can say both in the same survey, because they're not meaning the same thing that I think we are when we say infrastructure in healthcare.
Mm-hmm. David, are there any more questions in the chat room?
We have one more.
Okay, take that one and I'll ask you the last question.
All right. Last question here is, and it disappeared. Never mind, it is gone. So no more questions. So last one to you, Paul Mill.
So let's assume that you are a major advisor to the government just before meeting the First Minister's Conference. What advice would you give to the government so that coming out of that meeting on Thursday, it would be perceived by Canadians as a successful meeting, which could then give you ammunition to go forward for an early election, because things are much better and the governments are working much better together?
Oh, well, I mean, one lesson I learned from tracking public opinion over the last 8 months is Canadians much prefer their governments to work together than fight. Like, that has been the obvious outcome. And so anything in which this meeting leaves people sort of storming off or disagreeing deeply with each other is not going to make Canadians feel comfortable, right? They're looking for leadership. They're looking for cooperation and collaboration. So if I'm the federal government, how do I leave this meeting with having some control and outcomes? It's that, there's an agreement on getting this vaccine out in a way that gets it to as many people as possible, that creates confidence. I think that's the most important thing. And then number two is on the request for more money. I think you're going to likely, find the federal government is going to find common ground on that. And that will give them a platform to say, we did everything we needed to do to make sure that this pandemic, from both a health and social and economic perspective, was managed, and we protected you, Canadians. But I think they're always up against, the premier is always wanting more, and more money in particular. And I think, even there was a story today, which is not going to create the same kind of confidence. I think the Auditor General in Ontario said the provincial government still has $8 to $9 billion of its recovery fund that it hasn't spent yet. That leaves people feeling that not everything is being done that could be. And I think the federal government will take great strides to show that it is. And the recent news around the vaccine, I think, has been helpful for them, because the Conservatives lowered expectations by attacking them on that vaccine timing. And now, we're going to likely get vaccines earlier than many people thought we would. So that's what I think I would advise them to really focus on.
Excellent. Are there any more questions in the chat room?
No, that's all I can see right now.
All right, so I want to thank you, David. I also want to thank my chair of the board, Rob, to be with us today, and my team who's helped to collaborate and coordinate this particular session. I also want to thank the participants who have taken part in this particular webinar, and I wish you all well, and bonne journée à vous tous, et we'll see what comes out on Thursday. Thank you very much.
Thanks all.